Hello and welcome to Cahnmann's current event, Roundtable. Today we welcome back one of my favorite guests, who is the Consul General of France, Baptiste Boissiere. But you have to say it because pronounce your last name for me.
Baptiste de Boissiere.
Oh, beautiful. I wish I could say it as beautiful as you do. And we're going to be talking on a very, very interesting and challenging subject, which is the French healthcare system. And I'd like to read just for a second something about the healthcare system, which is in 2000, healthcare experts for the World Health Organization tried to do a statistical rating of the world's healthcare systems. They studied 191 countries and ranked them on things like number of years people lived in good health and whether everyone had access to good health care. Guess what? France came in first and the United States came in 37, which was very, very shocking to me. And Americans, I just want to ask you, Jean-Baptiste, that Americans assume that if it's in Europe, which France is, that it's socialized medicine. The French, their system, they don't consider their system socialized. In fact, they detest socialized medicine. And for the French, that's the British, that's the Canadians, and it's not the French healthcare system. Can you explain something about the healthcare system in France and why it's not socialized?
It's not socialized because most of the doctors are self-employed. So basically it's a private practice. And either your general practitioner is a self-employed or the specialist you would see is self-employed. And even if you look at the hospital side, it's true that the majority of hospitals are public hospitals, but there is a strong minority of hospitals which are private clinics. So it's clearly not a socialized system, and there's a minority of doctors who are civil servants.
Now, is there, I often hear on the British, and in fact, it was somebody from the ministry, the British ministry came on television, and he had said that in Britain there are long waiting lines, especially for elective surgery, and he was even talking about hip replacements, that it's rationed, and you have to queue up, meaning that you have to really line up for it. It may take 6 months, it may take a year, it may take longer. To get a hip replacement. And in the Canadian system, it's a very similar situation. In fact, many Canadians come to the United States for elective surgery. I know that it's a major surgery. I know it's done immediately in Canada. However, if it's elective, they could be on a long waiting list as well. What is it like in France?
It varies. The reputation we have, I think, is justified, is that it's a faster system than in UK, for instance. That's why you have some British people coming down to France to get treatment.
So they're coming to you as well.
Also, there are quite a few examples, but anyway, the British, they visit our country very often. Mm-hmm. But by and large, it seems to be a rather efficient system, whereby you can have an appointment or undergo surgery, for instance, relatively quickly. Plus, because of this hybrid nature of the system, private and public, if it's taking too long to get an appointment in the public hospital, for instance, you can go to a private hospital and still get reimbursed. But I don't think we have lessons to give. I mean, it's just that our system is relatively fluid and works fine.
Well, now you just mentioned public and private hospitals. What do you mean by public and private hospitals?
Well, a public hospital is part of the public sector. So basically it's managed by a public agency, 100% public ownership. A private hospital or a private clinic would be set up by a few surgeons and doctors with their own money. They would be like a company. They would invest in the clinic, then they would have agreements with the French authorities, and they would offer services of any kinds. And actually, I have some personal friends who are doctors in private clinics, and they have a stake in the clinics. So it's very customary. It's very useful.
So do people have to pay extra to go into these to see a private doctor or to get into these private hospitals? Is there extra payment for that?
There might be extra payment if, and I must admit it's generally the case, a doctor or a surgeon would go above the regulated rate for an intervention. And then the patient would only be reimbursed for the regulated rate. So there might be a difference. Also, I have to say, and this is something I think few people know, but it's very important, is that the professors and surgeons and doctors in public hospitals, they are generally of very, very high competence and experience. They are the best. They are authorized to give private consultation outside of their normal activities as professors in the hospital. So it gives an element of flexibility because it's relatively easy to see a professor, and there the tariffs would be quite reasonable. So you get access to his expertise, but it's as fluid and as easy as if you see a private practitioner.
You know, Americans often assume that when people get universal coverage, they give up their choice in doctors, hospitals, and care. And that doesn't seem to be this case in the French system. Am I correct? Or can you pick out any specialist that you want to go to, say that you need a knee replacement and you hear that this one specialist is, he's outstanding and you want to go to that particular physician? Are you able to go, or do you have to go through your general doctor? Can you go directly to the specialist, and how does that work?
We have reformed the system a little bit recently for cost efficiency purpose. Now you have to choose a general practitioner, whomever you want, but you have to choose one. And before you go and visit a specialist, you have to go through your general practitioner because all the data, the studies have demonstrated that going through your general practitioner results in a better use of the system. So that's the only constraint you have. I mean, you can bypass your general practitioner and see a specialist, but then the reimbursement rates would be lower. So there's a very, very strong incentive to do so. But it's a reform which has been well accepted after some reluctance by the French people and works well.
Yeah, because right now we can, unless you're with like an HMO, which is a special, it's a group that you pay a little bit less for, and you have to also go through your family doctor or general practitioner or internist first. But if I wanted to go see an orthopedic surgeon because I was having some pain in my arm or my knee was